Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast for people living with diabetes. The goal of our podcast is always to empower you with knowledge. May is Healthy Vision Month, and so today we're going to spend some time talking about something that is incredibly important for everyone living with diabetes, and that is your eyes. Diabetes is one of the leading causes of preventable blindness in adults, and yet with regular eye exams and good overall diabetes care, most vision loss from diabetes can be prevented or significantly slowed. Today we want to talk about why eye health matters, what people should be doing to protect their vision, and we're going to hear a powerful personal story from someone who has lived it. I'm your host, Dr. Neil Skolnik, professor of family and community medicine at the Sidney Kimmel Medical College of Thomas Jefferson University and associate director of the family medicine residency program at Jefferson Health, Abington. And joining me, as always, is my co-host, Lucia Novak. Lucia?
Hey everyone, I'm Lucia Novak. I am so excited to be here. I'm a nurse practitioner and I practice right outside of DC with Capital Diabetes and Endocrine Associates. And I am super excited about how to protect your vision.
That's right. And we have a special guest today, Sterling Glass. Sterling has lived with type 1 diabetes, and in his 30s, he lost his vision due to complications from diabetes. He is also an incredible advocate for the American Diabetes Association. He just joined us on Capitol Hill earlier this year at our call for Congress. And if his name sounds familiar to some of you, that may be because Sterling is also a member of the legendary six-time Grammy-winning, yes, I did say six-time Grammy-winning Blind Boys of Alabama. And he is almost the reason why I missed this podcast this evening, because I started listening to his music and I lost track of time. Sterling, we are so grateful to have you here with us today.
Such a pleasure to be here. Such a pleasure.
Sterling, before we get into eye health specifically, can you share with our listeners a little bit about yourself, kind of taking us back years ago when you were diagnosed with type 1 diabetes and what that was like for you?
Well, for me, I was about 19 years old, and I went out and I had gotten a job. And in fact, the job was with a company called APAC. They did the care of the roads and the highways and everything. And we had went out and we were working at the A&T University in Greensboro, North Carolina. And as I was on the roof, my boss man had said something that was so funny, and I didn't even notice it myself. And he said, "Hey, fat boy, stop drinking all my Gatorade. That's got to last us all day." And everybody just fell out laughing. And, we didn't pay any attention to it, but I had drank about at least 10 or 12 bottles of Gatorade. And, nobody really paid any signs to it. But later on, about 2:00, I told him, I said, "Look, I don't feel right. I feel like I'm about to faint." So they got me off the roof, and the supervisor took me home. And when I got in the shower, I fell inside of the shower to where I just collapsed. So when I got out of the shower, I was so weak, I made it into my bedroom, put my clothes on, and I laid in the bed for about 4 days. And my mom, she said, "No, this is not a virus. This is none of that. Something's wrong." So she took me to our family doctor. And when I got there, my sugar was 625.
Oh boy.
And he said, "Sterling, I don't know how you made it in this office, but you're not leaving here until you get insulin. And you're going to start insulin today." Now, here I am, 19 years old, getting ready to turn 20. I'm like, no way. I'm not using any insulin. I don't want to be a diabetic. I can't do this. I've seen my mom take shots every day, and I've seen what has happened to her. I am not a diabetic. I don't want to be a diabetic. So at that point, They did. They gave me insulin. They sent me to the emergency room. The emergency room gave me several bags of fluids and insulin as well. They got it down to about 325. So they sent me home. I went home thinking, how am I going to live? Now, not realizing that I had been a diabetic all the time. We never really saw the signs. I mean, my feet would swell when I was a young child. I would have episodes where I didn't even go to school because I would be so sick and so tired that I couldn't even get up in the morning time. And this went on throughout my high school years and my pre-high school years. And, my mom she was sick herself as a diabetic. So she never really thought, maybe my son has diabetes. But, if we had knew the signs and really had the care that we needed beforehand, I don't think it would have gotten as bad as it did so fast, if that's an answer.
Sterling, thank you for sharing that, because there are so many people listening to this podcast that are living with diabetes, or they have someone they love who is living with this disease. As a nurse practitioner, these are the stories I hear when I'm seeing patients for the first time and asking them to retell what happened when they were diagnosed. Were you sick? Did you end up in the hospital? So you are really bringing truth to what we are seeing. But I would love to ask if you would not mind sharing with us how your diabetes evolved over the years. When did you first notice the changes with your vision? If you wouldn't mind walking us through what it was like in those moments. What did you
Right.
see or stop being able to see? What was going on through your mind? All of that.
Well, as so many people, I was working every day, and my job, they had changed me from first shift to third shift. I was working 12 hours, and I was going to work, and I had some issues where the company I was working for, they didn't allow you to bring in your tester or your insulin because they said blood-borne pathogens. And the co-workers were complaining they didn't want the needles and they didn't want the tester in the plant. So I would leave it in my car. So I had an episode where I passed out at work, and I was in the back for about 3 hours, and they had to call the ambulance, and I went to the hospital. And of course, my sugar had dropped because I took my insulin before I went to work, and I didn't eat because I was trying to do my job. And my sugar dropped to about 45. So when I got to the emergency room, they had to give me glucose tablets and everything to get my sugar up. And after that point, my wife said, you need to go have an exam. So I said, no, there's nothing wrong with me. I just got to figure out a way to monitor my sugar while I'm at work. So she just kept nagging me. And she said, well, you need to go have an eye exam because you've never had an eye exam. Now, I had 20/20 vision. I wasn't having any vision issues. I didn't wear glasses or anything. But because my wife kept nagging me, I went to the doctor, Dr. Shapiro. And when I got there, he said, Mr. Glass, you have perfect vision, but I feel like I'm seeing something behind your eyes. And I want you to go see a diabetic specialist. I said, but if I got 20/20 vision, what's the problem? He said, well, this is just to make sure there's nothing really serious wrong. So I agreed, I got 20/20 vision. I don't have anything to be worried about. So I did. I scheduled an appointment with Dr. Sanders in Greensboro, Piedmont Retina Specials. So when I got there, he came in the office and he said, Sterling, I have some bad news. I said, what? He said, you have severe bleeding behind your eyes. I said, man, are you crazy? I just went to the eye doctor and he says I have 20/20 vision. I don't have any issues. So what are you talking about? He said, you have severe diabetic retinopathy behind your eyes. He said, I'm surprised that you haven't woke up one day and been blind. He said, let me ask you, have you been having any headaches? I said, yeah, I've been having headaches for about a year now. And I've been going back and forth to the doctor. They said it was my sinuses. He said, no, the number one sign of the bleeding behind the ears is pressure behind your eyes and a headache that you can never get rid of. And I had been having that. So I knew that he was telling the truth when he said about the headaches. So he said, what we got to do is we're going to start with your left eye. We got to do emergency surgery. You need to go home. You need to talk to your family. So they did. They did the emergency surgery on my left eye. And I lost the sight in my left eye the same day because the eye was so weak because of the damage that it just couldn't heal itself. It just couldn't take any trauma. So, you know, it was a life-changing experience from the very first day that I went into Dr. Sanders' office.
Sterling, just listening, I can barely imagine what you were going through, but it also reminds me of so many stories I've heard from patients in different areas, whether it's blood pressure that someone's afraid to go to the doctor for, or even after the doctor tells them, after I say, you need to take care of us, they go, I feel fine. I don't need to do anything. And you know, we all have that tendency to want to be well and also to put off anything that doesn't feel right to us, that makes us feel either weaker or vulnerable. I know I do it, and I see many patients do it. And I think it's really an important point in your story to pause and just to remind our listeners how important it is to go in for those eye exams early on. Because there are things we'll talk about over the next little bit that we can do to prevent progression of diabetic retinopathy and vision loss. But boy, it is a team effort, and the team always begins with the patient. The center of the team is always the patient. Lucia?
I cannot agree with you more, Neil. This is just insane how quickly life changed for you, Sterling,
Yes.
in like a minute, it seemed. You know, one
Yeah.
minute you're seeing, the next minute you can't. And again, how traumatizing that has to be. You were a young man. You had your full life ahead of you, and now you're losing your sight. Um, you know, I think what I'd like to make sure and how I describe this to my patients is because it's a silent disease, diabetes. I
Yeah.
kind of wish that your body would be full of pain the minute your sugar goes up above normal, because
Yeah.
pain brings people into the office.
Yes.
Silence doesn't, right? And so I
Yes.
tell my patients, I want you to think of the sugar in your bloodstream like termites.
Yes.
And the houses and the buildings that these termites are going after are your eyes and your
Yes.
kidney and your nerves. And when I
Yeah.
start putting it into terms like that, they start to understand what the termites are doing to the vascular structure, the veins and the arteries of
Yes.
the eyes, and causing them to bleed and leak, and how quickly you can go from being sighted to having loss of sight.
Yes. Yes.
Lucia, I love that analogy. I've never heard that before, and I'm going to start using it tomorrow. Um, uh, can you go over with us a little more so our audience understands? We'll spend a few minutes talking about diabetic eye disease, diabetic retinopathy, and can you go over for our listeners the things that contribute to eye disease from diabetes and how it evolves?
Absolutely. So we hear the saying that the eyes are the windows to the soul. Well, the eyes are the window to really what's happening with your diabetes before you even know it, which is why it is so critical that everyone who has diabetes get annual eye exams. And the reason why is that what contributes to the eye disease most significantly, of course, is going to be high blood sugars. High blood sugars, again, thinking of those termites. But it's more than just the high sugars. In fact, the retina of the eye is probably the most metabolically active organ in the body, and it reacts to very sensitive changes. So when your blood sugars go up, there is a cascade of events that happen. There's things that promote inflammation, things that promote new vascular or blood veins that are supposed to feed the areas of the eyes that were damaged. The problem is these new veins are very weak and they don't have very strong walls. So they develop quite a few of them, but they're leaky. And that leakage can cause swelling to the vision center of your eyes. It's called the macula. And once the macula has been impacted, even if you can see perfectly, your vision is at risk. And then you throw in that diabetes is a buy one, get three free disease. So you're not just worrying about sugars, but blood pressure management is really important in protecting the eyes. Cholesterol management is important. And so when I'm trying to convince patients why they need to be on certain medications, that it's not just about the sugar, we're going beyond that. I want to promote quality of life for you, have you live a life with as few complications as possible. And so at the heart of it is definitely the high sugars, and getting them in a safe range and keeping them stable for as much as possible really buys your eyes time.
Yeah, it's so important to realize, and it isn't easy. It's a lot of work. And then the importance of seeing the eye doctor, the ophthalmologist or optometrist, whoever is keeping an eye on those eyes, is so critical because while years ago there wasn't a lot were able to do to slow the progression other than managing blood sugar, high cholesterol, hypertension. Now there's a lot that our eye doctor colleagues are able to do when they can detect early changes, those little changes in those tiny blood vessels that you talked about, Lucia, that early intervention matters. And that's why it's so important to remember to go in for those annual eye exams.
Yep. So when you get newly diagnosed as having type 2, it's upon diagnosis. So shortly after getting diagnosed, we want your little butt to march itself into your local eye doctor to get a dilated exam. If
Yes.
you have type 1 diabetes, the recommendation is that it's within 5 years of the diagnosis. And the reason that there's a difference is people with type 2 diabetes tend to have years of pre-diabetes where the blood sugars are above normal, not quite high enough where we say you have diabetes, but
Right.
even those mildly elevated sugars can cause damage, which is why we say as soon as you have that diagnosis of type 2, you need to be going in to get your eyes examined.
Yes. Yes.
So important. And, it's amazing the technology that is available now, because we know that this podcast goes out not just to people who live in a big city, but also people who live 200 miles from an eye doctor. And the
Mhm.
technology is available now wherever you are. Even if you can't get in to see an eye doctor, often now primary care doctors are able to do what is called retinal photographs. We actually do them in our office, even though we are near a big city. Sometimes it's hard for our patients to get into those eye doctor appointments. And if they haven't been able to, we take a retinal photograph. It is then read by an eye doctor, and they can either say things are fine or here, this requires coming in to be seen. And, it's hard to get through anything these days without mentioning AI, but there actually are now retinal photographs that can be read by AI that are FDA approved, high degree of precision. It's an area where there's so much work being done because it's so important.
Yes. 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 Yes.
Sterling, as you're listening to all of these things that we can do, your thoughts.
Well, I would say that the first thing is take diabetes very serious and know that it's not your friend. And if I had known what I know now, I don't think I would be in this situation because I would have taken it more serious. I would have done whatever it takes to save my sight as well as the other complications. I mean, the nerve damage and the pain that you feel in your feet, the neuropathy, these things are real. These things are real. I know that when you hear somebody talking about diabetes, you say, oh, yeah, that's not going to happen to me. But I'm telling you, with time, these things do happen. And it doesn't take years. Diabetes works so fast. You can be healthy today, and tomorrow you can start showing the very first sign of diabetes. So take it very serious.
So, Sterling, I want to switch gears again and come back to you and some of the amazing things that you've done. How did you decide to become an advocate with ADA to spread the word about the importance of taking care of diabetes?
Well, for me, it is very heartfelt because my mother was a diabetic and my mother died at the age of 58 due to complications of diabetes. And my sister, two sisters, both of them are diabetics, and one is facing kidney failure as we speak. My father is a diabetic. So for me, it is a very sensitive subject. And I felt like, okay, you know what? I'm not going to lay down and let diabetes destroy my family. I'm going to get up and I'm going to fight. And how you fight is by getting knowledge and understanding and then sharing your knowledge with others. And that is why I became a member.
That is fantastic. And it's often life presents us with decisions, right? We
Yeah.
feel overwhelmed and then we most of us, at some point get feel down, but then we have a decision to make.
Yes.
And right, and it's either move
Mhm.
forward and you've done amazing things with your life, even with all the vision loss. Can you just, before we close, tell us a little bit about your career and the type of music that you do?
Well, I love to say hello, everybody. It's me, Sterling Glass, from the Blind Boys of Alabama. That's right, you know who I am. Six-time Grammy winners, and I thank God for those guys. Oh, being a part of this group has been such a great part of my life because I had really never been around any other blind individuals before in my life. So when I had the opportunity to become a part of this group and to really be around them every day. We're with each other more than I'm with my family. We're out on the road about 200 to 250 days out of the year
Mm,
together, and they teach me how to live as a blind individual.
mm.
Not all of the guys have lost their sight due to diabetes. I think I'm the only one, but still, blindness is blindness, and they teach me so much. And then just having the privilege to be able to travel all over the world, Europe, Australia, and to go out to all these places and to have young children walk up to me that are blind and say, can I shake your hand? My parents brought me here to see you guys, and I'm blind. And to hear their
Mm,
stories and to know that this has not only happened to me, but there are so many million of people in the
mm.
world that diabetes and these other diseases are affecting. We have to spread the message. And I thank God for this avenue that I have.
Thank you for being so clear about that. Lucia, as we're getting toward the end of our podcast, are there any resources that are available if our listeners want to learn more about diabetes and eye disease?
Absolutely. The ADA has tons of resources, and most specifically for this topic, if you go to the website diabetes.org and you backslash and type in eye health, you'll get information on the focus of diabetes, which is focus on the eyes. And don't forget the importance of asking whoever the healthcare provider is that's helping you manage your diabetes. If you haven't yet had an eye exam, inquire. Where can I go? Do you happen to have a camera? Some neighborhoods actually have portable vans that or portable cameras that they have in vans. So Find out what your resources are in the areas that you live. You would be surprised how accessible some things are once you start asking questions.
Really good point. Any final thoughts, Lucia, for our listeners?
No, Sterling, you have been an inspiration and a motivation for people out there that are living with vision changes and feeling scared about their future. And hearing your story and how you turned your future around, I'm sure has made many of them fill with hope. Thank you.
Now I have a little jingle. I want to sing it if it's all right with you guys.
Oh, we love it.
Let me know when you're ready.
We are ready. Well, let's do the jingle and then any final thoughts you have for our listeners. But first, the jingle.
All right. Hello, everybody. I have something to say. If you're living with diabetes, take it serious and don't play. You have to monitor your levels each and every day. You have to eat the things that's right, and you have to continue to fight. You have to learn all you can and clearly understand whether you're living with type 1 or type 2. Don't let diabetes destroy you. You have to love yourself and take care of your health.
That was amazing. I can actually hear our listeners out there applauding in their homes and cars and while they're exercising on the elliptical listening to this. Hey, Sterling, that was great. Any final thoughts you want to share before we bring the program to a close?
Yes, I'd like to say thank you to the ADA and all the organizations that work with diabetes. It is a very serious disease and it affects everyone, not just one person. Someone that everybody knows someone, if it's not themselves, that is affected by diabetes. Don't let fear hold you back from getting the treatment that you need.
Such an important message. Sterling Glass, thank you so much for joining us.
Yeah. Thank you, doctor. Thank you, practitioner. Thank you so much for allowing me to be here.
And most of all, of course, thank you to our listeners who you are the people that make this worthwhile. May is Healthy Vision Month. Let it be one of the reasons you pick up the phone today, schedule your dilated eye exam, or call a loved one with diabetes and remind them to schedule their eye exam. Eye disease from diabetes is largely preventable when caught early. So remember to discuss your eye health with your care team and your family. Also, on the program notes here, look, we're going to make sure to include some links to some songs by Sterling and his group. And my personal favorites, I'll name two, are Happy Train, which is just uplifting, and we all have to have two sides to us, right? Bad Boy. I love that song. So for the American Diabetes Association, I'm Dr. Neil Skolnik. Thank you for listening.